The AIDS Crisis and the Band Played On Film. The film and the band played on depicts the period when the epidemic of HIV and AIDS spread across the United States and the rest of the world during the 1980s. Since the infection seemed to influence gay men generally, authorities at first called it gay-related immune deficiency. Even though the Centers for Disease Control, CDC, found all significant courses of the illness transmission, just as the fact that there were infected women, the public thought about AIDS as a gay infection and was known as the gay plague for a long time after. The film addresses how the disease uncovers different separation points of social and economic injustice, making the issue exceptionally political. Legislative concern has been the primary driver of inaction and the forswearing of AIDS. Inaction mirrors a political refusal or reluctance to take part in delicate issues, especially those inseparably connected to HIV transmission. The authorities have denied the connections between HIV and AIDS, choosing not to see the effect of AIDS on society, which hindered progress. For example, while Francis researches AIDS and theorizes it as a sexually transmitted disease, the CDC delays his endeavors as they are reluctant to demonstrate the disease transmission hypothesis. In addition, scientists fight for the right of those who ought to get recognition for finding the virus. If there had been an early intervention of political initiative, without question, the epidemic would have been successfully addressed. Alone, it cannot guarantee a compelling reaction. However, with the assistance of local area preparation, general well-being support, and developments in science, even the most difficult medical problems can be relieved. Progress in healthcare has its foundations in a synergistic blend of political administration and science. Today, various tests can distinguish HIV, the greater part of which are available to the public. People are more aware of the transmission passageways, but people still associate the disease with sexual transmission, while many infected are the victims of contaminated needle injections and HIV positive from birth.